Hannah, I do have one question just about some of the numbers you were giving us. The numbers on childcare sector job loss, 40% of providers might go out of business, 4.5 million slots could be lost. Where do those numbers come from? And were those numbers from kind of the low point of the pandemic, I guess earlier in the spring, or are those, how up to date are those?
Sure, I can speak to it, and Linda might want to speak to the survey that they've done as well. So the 2 out of 5 providers that are looking at permanent closure, that was from, I believe, a July survey. This is really hard to track in real time. I would say that probably each of us is individually hearing about childcare programs on a weekly basis that are closing permanently. But I think it is pretty hard to track in real time the closures, because some of them, it's the temporary versus the permanent nature is hard to tell. I will say even as we've seen some childcare programs reopen, and we certainly are not seeing, for example, the unemployment numbers that we saw in the spring, we are not rebounding. So it's still, 1 out of 6 childcare jobs that has been lost. And it's hard to imagine that we, again, without a real investment in this sector, that those jobs will just simply return by opening programs.
Okay. Linda, did you have anything else to add on that, or numbers?
Yeah, I'm going to second what Hannah said, that it's really hard to understand some of these things. It's a moving target, and as states open and reopen and close and whatever, a lot of things are going on out there. But our survey data that we last did our survey the first week in August, and according to that survey, between programs closed and programs working at reduced capacity, whether it's reduced ratios or just reduced closed rooms, 70% of the capacity, a little bit over 70%, 72%, I think, of the capacity of this country is down. What that translates into the workers, we have not asked that question where I am.
Okay. So I want to ask a question to kind of all three of you. I'll start with Catherine, because it stems off of something that you and I had discussed before, but it's something you all have said a variation of. Catherine, when we talked before, you said that, quote, this is the dire moment. If action is not taken, there will not be a child care system to come back to. So I was hoping you could kind of encapsulate what are the driving factors in that view, and how will it be possible to convince the public of that? I mean, the public is, particularly in a year like this, the public is always hearing that, some particular issue or sector is kind of at its, at a moment of peril. How do you convince the public that this is real, as opposed to what, the last crisis they heard about was? Catherine, if you could take this first.
Yeah, so I can start with some of the factors. I mean, I think the biggest one is where we started with our childcare system. As we've talked about, it was barely hanging on by a thread even before the pandemic hit. And now you're seeing this mix of fewer parents sending their children to care, providers facing higher operational costs, and parents losing their jobs and income so they can't afford childcare in an even more dire way than they experienced before the pandemic. And I think the way we make this real for people is talk to folks in your community. I mean, truly, anywhere you look, there is probably a childcare provider behind that person. As I mentioned, I am a millennial without children, and this is the issue that I devote myself to, because I look around and I see that the person I get my coffee from relies on childcare to go to work. And now she doesn't show up anymore. I was actually at a Trader Joe's the other day buying groceries, and someone had to run out because her childcare provider had to unexpectedly close because someone tested positive for COVID. So it is having this ripple effect, not just on the parents, but on everyone else who relies on those parents who come to work every day. So I think it's important to think about sort of, again, the cascading and spillover impacts of lack of affordable, high quality childcare on all of us, whether we have children or not.
Okay.
Chris, can I jump in on this one a little bit? Because we've been looking at this issue, and prior to COVID, we had a huge gap out there between what the projected need is for care in this country and what do we have available. So we went into this with a real serious challenge. To begin with, we're going to be releasing, I'll give you a sneak peek at this. We're going to be releasing an analysis at the end of this month of 25 states in looking at the gap in what the projected need would be based on the work, their parents' participation in the workforce and the age of children against the capacity of the system in these states. There is a gap in 25 of our states for almost 3 million spaces. So we, between what the states have and what we need. So we went into this, I would say, crippled, to be honest with you. And now coming out on the other end, it isn't so, it's going to be critical what we have at the end of this, but it's only going to make a bad problem worse.
Okay, and finally, same question to Hannah. I mean, how do you convince the public that this is real?
Yeah, so I don't think the public at this point needs convincing. I think it's policymakers. I don't think there is a working parent today that does not know how real these childcare issues are. And as a parent of school-age children, I can echo that. I think what the public perhaps didn't know and is learning now in the crisis are those elements of the market failure of the system. So it may not have occurred to parents to think that if their childcare closed temporarily as the schools shuttered, that it would not actually reopen. I don't mean to minimize there are some huge fiscal needs in the education system as well, but at the end of the day, when it's safe to do so, we don't doubt that the public school in our neighborhood won't be able to open its doors. I don't think parents realized their childcare was that vulnerable. So I do think that the convincing is to get policymakers to act. And even there, I would say there is an increasing recognition and understanding. We talked about the CARES Act funding that was $3.5 billion, a paltry amount, I would say. Since then, we have seen bipartisan proposals in both chambers of Congress that are $15 billion, $20 billion. The House of Representatives passed bipartisan legislation for childcare relief and increased investments over $100 billion. So I actually think that this is a moment that the real childcare needs that every family has long known about and felt like they had to deal with on their own is becoming an issue that the policymakers do need to respond to.
Okay.
Can I jump in on that, Chris? Because
Sure.
I want to second what Hannah said. I mean, we have had amazing bipartisan support on the Hill on this issue, with varying degrees in terms of the amount of dollars that people think that need to go into the program. My concern, and I think some of our concerns, is that sometimes they see this as a short-term issue and it's really a long-term issue. We need stable funding long-term, not just a short-term, let's fix it for the next year or so and then go back to business as usual. And that's why I keep trying to make people understand the business model was broken before. It's only been, exposed during COVID. We need a long-term solution, and it isn't just a one-time fix here.
Okay, Linda, what's the definition of bipartisan? I mean, is this something that most Democrats and just a couple Republicans, or is it more broadly split?
I think it depends on the chamber at this point, but I think in the Senate in particular, we've had fairly broad support. I think we had Hannah, you may understand, I remember how many signed on to a letter. I think it was 23 that was a bipartisan letter asking for more childcare funding. So we've had it's not just one or two.
Okay.
Yeah,
So
and if I could add on to that, actually, I think so the bill that Hannah was mentioning that passed in July had 18 Republicans voting yes, voting to pass over $100 billion. That is huge. And in addition to the letter that Linda was mentioning, we also even saw news reports earlier this week before negotiations collapsed that Secretary Mnuchin was talking about $25 billion for childcare. So, I mean, that is a pretty big deal to have everyone talking about significant sums of money.
Okay. So I would hope to have each of you talk a little bit about the policies you might be advocating for, depending on what happens on November 3rd. I mean, if President Trump is reelected, are there certain policies that you would push for? And if Joe Biden is elected, are there certain policies you would push for? Will they differ by who's in the White House, or are they the same and you'll just, expect a different kind of reception? I mean, maybe Catherine, could we just start with you? What are the 2 or 3 things you would most like to see the next administration and Congress do?
Yeah, so to answer your question, I don't think it changes. This is grounded in real historic needs in the program and for families and childcare providers across the US. And that's not a political or partisan issue. That is what communities need now and what they're going to need in the future. So I think the first thing is we need relief to stabilize the industry. The $3.5 billion that's been provided is gone and it was never enough. And we need to secure relief immediately. The second thing is we need to build and pass legislation that provides childcare for all. So that makes childcare accessible and affordable for every family, that ensures providers and workers receive the compensation, benefits, and support that they deserve, that care is high quality for children, and that everything is done with a focus on racial equity. So we're thinking about who is getting support first, who is getting the most support. And that needs to be the next thing we turn to, because simply stabilizing the system as it was is not enough. We cannot go back to the way we were, which was inequitable and always underfunded.
Okay. Linda, what are the 2 or 3 things you would be pushing for most?
Well, I think, I would agree with Catherine that I don't think that the discussion changes a lot, in terms of the fundamental issue in terms of the need for significant investments in funding. I do think that we need to, and one of the things that we've had a lot of conversations about is a look at how we get money into these programs so that we have, back to one of the points I made earlier, money going into the supply as well as into the demand. In other words, most of the federal money in almost all states goes in through parent certificates or vouchers into the programs, and that is the demand side of the equation. What we need is to figure out how to get consistent, reliable dollars into these programs that they can depend on. So I think we need more money, and then we need to figure out a plan for how it goes in there to stabilize these programs longer term.
Okay, and same question for you, Hannah.
Yeah, so at the risk of being repetitive, I'm going to agree and then add. So absolutely immediate relief to the sector to just be able to keep it afloat until parents return to using it. A down payment on the long term, which means really, again, changing how we fund childcare. We shouldn't be dependent on annual appropriations every year. There needs to be a funding mechanism so that parents who need help paying for childcare get it, period. So I agree. Those 2 things I think are moving forward. There is momentum in Congress, regardless of who is in the White House. What I would add to that is I just want to briefly mention also the need for paid leave that goes along with this. And that's another issue that I think policymakers in 2021 are going to need to deal with. Congress did a first step on that in the Families First Coronavirus Act. And I would just flag relative to this conversation that it included childcare and school closures as a reason that parents could take leave. That leave expires at the end of the year and we will not be out of this crisis. So expanding that leave, making it permanent so that parents have and everyone has the ability to take time off to care for their loved ones when they need it. That is a part of this system as well.
Okay, and on to reiterate something that Hannah just said, we will be talking about paid leave in our next program, which will take place after the election, but we're going to be having a whole hour just focused on paid leave and paid sick time. So watch the NPF website and we'll be sending out notices on that as well. Hannah, I do have one kind of question about the block grant program. Could you give me just a little bit of a sense of how much it varies by state, both in the funding levels and in the models that they use? And are there some states that do a good job, with the model that they use and other states should emulate?
It's always the question, what's the best state? So the funding levels, I'm not sure whether we said it, the bulk of the funding for the block grant is federal funding, but states do have to put up a state match to be able to draw down all of their dollars. So for the most part, most states do that and meet their full match. So they're drawing down all available dollars. So the size of the funding really varies. I mean, the reason I hesitate to give a good state example is that this is a little bit of a seesaw, right? So because states are making decisions across a range of issues, you could look at one state and say, wow, they have a huge program, they're serving lots of kids, but they might have very low rates that they're serving to providers, right? Or vice versa. So it really is a complex system. It's hard to pick one element. I think what we can say universally across the board is that it really is important that states as well as the federal government are putting more money into childcare. Again, this is a public good, and there really needs to be contributions at all levels to get to the level of financing that the system needs.
Okay.
Tracy, if I could jump in on that too, just a quick second. I do think, getting back to this issue of the money going into supply, some states have used the federal regs and allow for money to go into both the certificate subsidy side of the program as well as contracts or grants to programs. Very few states use the grant or the contract option. Massachusetts has done it for a very long time. California does it. There are a few states that have done it. Some states have started doing it as a result of the COVID experience, understanding that's how to stabilize. So I think when it comes to federal policy, there's options there for states that they're not taking necessarily that could help this situation enormously as we move forward. So examining a balance of subsidies and certificates and grants and contracts would be a step that states could take to help this.
Okay. I have a question or two from Sunny Efron, who's the president of NPF. Sunny, are you there? Floor is yours.
I'm here. Hi, thank you. Thank you so much for being with us. I have two questions for you. One is a data question, which is, has anyone done the cost benefit analysis of investment in child care system as a proportion to GDP? I'm assuming that that number would shift based on the unemployment rate, so it would have been quite different, a year ago when we were at full employment from what it looks like now when people don't have jobs. And I imagine that opponents to sort of general increases in the child care subsidies would say, oh, but that's not really, economically calibrated. What do we know, and how would you answer that a question of proportionality?
I don't have the answer on the GDP piece. I don't know if my co-panelists do. I do think that your point about how the relationship to the unemployment rate is exactly right. And that is one of the ways in which the childcare market fails. If we think again about childcare serving the needs of children as well as parents, it makes no sense that a child would lose access to childcare because a parent lost a job. And it makes no sense for them to have to leave that setting. We would not expect that a third grader would leave school because their parents switched jobs. And that is exactly what our childcare system requires of parents. So I think part of what you hear in us talking about moving away to a new system, and I'm sorry I can't answer the data point specifically, is that we need a system that is a work support, but not dependent on parents working. It should be a support that is available to families as they move in and out of needs, as their children need different settings based on where they are developmentally, and as parents need different available care options based on their work. It should not be kind of an on or off switch.
Yeah, and then just to add on about the data, so I think the last stat I saw, again, before the pandemic, was that the US spends about 0.5% of their GDP on all sort of early care and education, which is about half of what other developed countries invest. So if you're looking at where we are putting the dollars we have as, frankly, a very wealthy country, we are not investing in our kids, we are not investing in childcare teachers, and we are not investing in parents. And the other data point that I think is really compelling is what we lose by not investing more. Because I think sometimes people get a little bit afraid when we're talking about the dollar figures. But even before the pandemic, we were losing out in about $57 billion each year in economic productivity and revenue losses, simply because parents didn't have affordable, high quality childcare. So there is a lot at stake, and we don't invest enough.
Yeah, and this is Linda, and I think that that's about the number. I think we can check on that and get back with you, but it is substantially lower than any country. I think we are pretty much at the bottom of that rung. But
yeah.
We would love to have that, whatever data you have, and we'll be happy to put it on our website. So I have one more question. and again, it's a kind of a philosophical question for the next Congress. People like Andrew Yang, for example, who is not the Democratic nominee, but nevertheless, if he were here today, I imagine he'd be saying, hey, folks, why invest in all these individual subsidies? What we really need is a minimum family income, and then parents can decide, whether they need this for childcare or to prevent themselves from being evicted, or, that it's really empowering to low-income Americans to let them, have the money to make those choices rather than to having to apply for this, endless hodgepodge of very confusing programs when the data shows that they often don't take advantage of things that they're actually eligible for because they either don't know or there's barriers or whatever. So anyway, how would you answer, not the specific of are you for or against a minimum income, but how would you answer the thrust of that question? How would you advise the next Congress when supposedly there are hearings, in February or March on this issue?
I think it doesn't have to be an either or. So I would first just offer that I think we in the childcare field and many other supports for families and children have been operating in a scarcity mindset. And we know that we're a rich country and we can find the revenue, to pay for both of these things. And then the second thing I would offer is that, we need to be thinking about how we're creating an entire childcare system. All of us touched on some point about how childcare has both the family and parent component and the workforce component. And you need to be thinking about how we're creating a high quality system and how we are ensuring that providers and educators are compensated well. And for that, frankly, you need a dedicated and specific investment in building such an infrastructure.
Yeah, I would second what Catherine said. I don't think it can be an either or. I think all of what we have been talking about is, and we've heard it from each of us, is making this affordable. And that is, I think there's no one way to make it affordable for families and pay the workforce what they need to live, to be honest with you. So I think we need a combination of helping families more, but also the providers. And I don't think that comes from just a one-sided.
Yeah, I mean, the only thing I would add, I agree with both of them. I think that as we're talking about building out a system, there are a lot of costs here that need dedicated investment, infrastructure. We don't have enough safe childcare settings, paying to support providers and increase their education and training, institutions of higher education being able to support early childhood programs. So the level of kind of systemic building that we need to do goes beyond just giving parents more money to be able to purchase care. We actually need to build the care system as well.
Okay, one last question for all of you. Our guest last week, we had Dr. Jack Shankoff on talking about toxic stress and the effects of disruptions and hardship on children's brains. Hannah, you mentioned kids being yanked out of school. Kids don't get yanked out of third grade when their parents lose their jobs, but they do get, very young kids get separated from their child care providers with whom they often have very close bonds, right? Do you see a psychological problem, forget about the money, for kids who are being essentially kind of having their, care relationships jerked around by this pandemic that they're much too young to understand?
Yeah, so I mean, it's interesting because we've been talking about the impact on kids, even though kids in many ways seem to have avoided the worst direct effects of the virus in terms of illness and death. I think they are absolutely bearing the brunt of the economic crisis for a number of reasons. The stress that parents are under, the financial stress impacts children directly. The instability for kids of all ages, losing their care settings and facing the insecurity that they are. I mean, we could go into food insecurity levels that we're seeing among children that are just unprecedented. So yes, I think we should be deeply concerned about children's experiences right now. And quality early childhood investments are one of the best ways to support them and their mental well-being as we go into the future. So I know we've been talking about childcare. Another really important part of the system is Head Start, and in particularly early Head Start, which serves very young children. Those are programs designed to meet the comprehensive needs of kids, and in particularly kids experiencing increased hardship and trauma. And that is what a majority of children in this country are experiencing right now. And I would say, in particular, again, really thinking about the needs of children in low-income communities and communities of color and immigrant communities that are facing some of the most direct impacts of the current crisis.
Okay, so thank you very much, Sunny. So I just have, we're about out of time, but I have one kind of general question for any or all of you. We've been talking about childcare as a public good. And so I'm just curious how other countries are treating this. I mean, what's going on in the countries that have the most robust childcare system? What do those look like, and which countries are those? Is that, Linda, is that something you could tackle?
I can, and then I'd refer your audience to the work that has been done up at Teachers College at Columbia, Sharon Lynn Kagan, who's done a look and has just published a book this last year that looks at, I think it's 6 countries and how they finance early care and education and some of the various components of it. I think that's the best resource. There's a number of different models out there. Obviously, the Scandinavian countries do things, and their approach to that, it is very different than, say, Australia, New Zealand, or Canada, which tend to resemble our systems a little bit more. But I think it does get down to, and one of the things we alluded to, and you're going to move into this next week, is foreign countries have done a better job of figuring out, sort of from the family and the child's perspective, what works. And so they have better maternity, paternity policies, paid leave policies, extended leave situations, which we don't have. And as Hannah brought that up earlier, and it is a significant part of what we should be looking at if we're going to look at a systems approach to what works for families. So beginning with maternity, paternity leave, some type of some variation, because we right now, and I'll just stop at this, I think the data is out there that shows that about 25% of young mothers go back to work after 2 weeks in this country after giving birth. That's criminal. And it's all of this whole focus on the birth to 5 period has got to get looked at in a more comprehensive manner. So I can send you the links to the work that Lynn Kagan has done up at Columbia. She's probably the expert.